Hi, everyone. I see some familiar names in the audience. It's great to see everybody here. A lot of you people I don't know. I did look at the list, so I'm excited to see everyone. It's been a while. So for those of you who don't know me, my name is Dr. Leah Houston. I am an emergency doctor, and I'm on a mission to save medicine. And I, along with 600 other doctors, invested in this new technology that can allow us to work and move freely. And a little bit of my backstory. I actually was working as a locums doctor for many years and went from hospital to hospital. You know how locums is. And I learned that a hospital actually was using my credentials fraudulently, billing under my name, committing Medicare, Medicaid, and insurance fraud with my credentials. And that led me to reach out to my physician colleagues. And I learned that there's a lot of things in credentialing that go wrong, people's names and PTAN numbers being used fraudulently for durable medical equipment, to open practices, things like this. And we decided that it's time for us to have ownership over our right to work, our data, and an ability to move freely. The credentialing burden of 4 to 6 months waiting for your next role to start, if you do change jobs, if you choose to change jobs, is part of what keeps doctors stuck in jobs that they don't like. And so without further ado, I'm going to share my screen and tell you a little bit about what we are doing to fix this problem. We're here to talk about Evercred and to show a demo. And it's going to be me, Dr. Leah Houston, and Mark Litchman. He is our Chief Product Officer, my co-founder. He is the one that manages product. And so we're going to show you what we're doing differently from everyone else that's out there. We're going to show you what we currently have in the market. Some of you have already used the application. And then we're going to show you what's coming next. And we're going to talk to you about how we're going to use this tool to free ourselves. All right. So most of the people in the room understand the problem of credentialing. It takes us 11 plus years to actually get training. And after that, we have to fill out these redundant forms to repeatedly certify and verify ourselves. And a lot of people who are independent, who work in their own solo private practice or cash pay, they say, oh, I don't have to deal with credentialing. Well, under the umbrella of credentialing is licensing, and you have to be licensed to practice. So everybody who takes care of patients needs to do credentialing, even if they don't have to go through the insurance portion of credentialing. And so it covers licensing, privileging at hospitals, health systems, and private practices, and then also enrollment in the payers. And when I've worked with doctors to develop the software, we worked very closely with people just to get them to find their credentials. Took 20, 30 minutes, and then they had to upload them and all these things. And this happens every time, repeatedly. Every time we switch jobs and every 2 years for regulatory compliance or when we update our licenses. And then it has to happen again and again and again. And so it's duplicated work. And if we're working for somebody while we're waiting to be credentialed, they're losing opportunities to have revenue because we are actually the revenue engines. They try to say that we cost systems money, but we're actually the ones that make systems money. And people who know that. And so not only are we not getting paid, not only are the places we work not getting revenue, even if it's our own practice, we're generating that revenue, but patients aren't getting seen. So this leads to delays in diagnosis, death, disability. And so this has real downstream impact on patients. It's why patients are feeling frustrated, why they are scrambling to get appointments and they feel rushed in their appointments. It's because there's not enough of us that are easily able to work, move freely, and pick up shifts when we want to, or open up our own private practices so that we can see more patients under our terms. And so that's the problem we're fixing. And the way that we're doing things differently is that most credentialing tools out there are really only serving hospitals, large health systems, large practices. Most of them are very expensive. And when we as doctors are asked to upload our stuff into that system, and if we ever leave that system, we then essentially are forced to redo that again over in another platform if we ever move. So we're tasked with this uncompensated administrative burden of repeatedly verifying, and we have no longitudinal record of our credentials. So what we're doing differently is that we're giving you a wallet of your credential data that you can hold, store, and keep from the day you graduate from medical school until the day you retire, and that can follow you for the life cycle of your career. On top of that, we make that data shareable and reusable with any health system that you or a private practice office that you want to share it with. And importantly, and this is the big differentiator, we're using agentic credentialing. We're using domain-trained AI agents to actually do the work of credentialing. And so a lot of people they've heard this word, agentic credentialing or agents or AI agents. And I want to break it down for you so you understand. We know what LLMs are, large language models, AI. That's essentially the brain. That's where all the data is. So we can ask ChatGPT and Claude and Perplexity questions, and it can answer us. And we're like, that's cool. It's like a library of information. Well, that's all it is, though. It's a library of information. In order to make that information actionable, meaning in order to execute any tasks on that information, we have a human. We can use AI, but now we have something called agents. And they're essentially MCP servers connected to this large language model. I like to use the analogy of the brain. The large language model is the brain, and the agent is essentially the body, the hands, the eyes, the mouth. Agents can talk. They can click on websites. They actually can execute tasks just like a human. And so the MCP servers are like the brain, the midbrain, and the spinal cord that allow for all the nervous system of the brain, the large language model, to actually execute tasks. So what I'm trying to say is essentially these agents can go do the same thing humans can do. They can go to the websites, they can do primary source verification, they can get the external data, they can type in information, they can fax, they can phone call, they can email. They can do all that administrative stuff that we've been doing essentially uncompensated, and the same thing for credentialing specialists. So we have a tool for you, the doctors, we have a tool for the credentialing specialists, and then we have a tool that actually does their work for them. And right now we have the actual wallets and the credentialing tool, and the agents are going to be launched soon, and that's what we're going to show you today. So this is basically our roadmap. What's live today is the wallet. Right now we are working on making it easier for organizations to invite other members, making it easy for them to invite other doctors. There's an audit trail, so any click that they as an individual human does, or anything that the agent does, it's audited and tracked so that we have actual primary source verification information that's kept. So when the regulators come by and want to audit you, we have all that information tracked in the back end. And so we're rolling out our first licensing agents. We're going to start with Texas and California. California has an API, as does the DEA. So we're going to roll that out in the next 30 days. And then we're working on other states, including New York, Florida, South Carolina, North Carolina, Illinois. There's a bunch of other ones, and we're going to roll out 50 states by the end of Q2. And we're really, really excited about it. So I'm going to switch my screen and show you the physician wallet. So when you first go to your dashboard, you see an overview of your credentials. Right now I have 17 uploaded. I can see things that need my attention. I can upload more credentials if I want to. I can share them. I can set notifications. I can see if there's anyone that I've shared my credentials with that has any questions, or anybody that's actually requesting me to share my packet who I haven't sent my packet to yet. And so essentially you can go to your credential wallet and see all the credentials you've uploaded. Now what happens? How did these get in here in the first place? So what you do is you click upload. You can browse a folder on your desktop. You can click any credential. And this is, for example, a fake license just to demo. And you can notice that it detected it was a medical license. You can click Smart Extract, and it immediately extracts the data, structures it, normalizes on the back end so that you can save it to your wallet. Now, what else can you do here? If I wanted to be notified, I can click Notify, and this is actually a free tool for doctors. So you can upload up to 10 credentials for free. You can use the AI to extract the data. You can set up notifications for expirations with email. But if you want to get text notifications, if you want to get more granular notifications, or if you want to do the agentic credentialing, you can upgrade to premium. And so we have a $2.99 subscription. And so I can go back to the wallet. And so for example, I just uploaded the California license. If I click verify, you can see the agents actually doing the work of credentialing. And when you open that credential, you can actually look at the activity feed and see what actually happened there. You can look at any of the documents that you've uploaded, and you can do that for any of your credentials. And as you notice, the credits, you use credits. So we give a certain number of credits with your subscription. If you wanted to share the packet, you could share it with whomever you choose. When you share it, they get a magic link. And so Mark is here. He's going to act as the credentialing specialist. And, I can also see that I did share it with that person. I can actually look and see what they're seeing on their side so I can have a view of who's looking at my information. And so this is what I didn't have. If I had had this, I would have been able to revoke my credentials and they wouldn't have been able to do the fraudulent billing. So this is part of why we're building this. You can see active notifications. You can mark them as done if you don't want to do them anymore. If you are a 50-state licensed doctor and you run out of credits, you can purchase more credits if you want to. And of course, we have all the other settings. So without further ado, I'm going to actually hand it over to Mark and have him share his side.
So thank you everyone for joining. I'm going to give you a quick tour of what the organization sees. So you can see the organization sees several packets. I've pre-populated this with a few different options. So as soon as the practitioner shares their credential packet, an organization does see that packet. They can navigate to specific types of licenses to make it super easy for the credentialing specialist to verify specific types altogether. As Dr. Houston showed on the practitioner side, we have a similar verify option here, which goes in and launches the agentic verification. It also creates a proof, which could be in the form of a screenshot that's captured from the site. In the case of employment history verification, which is something that is currently in progress, that proof might look like an email, it might look like a fax, or it may be a actual image that is documented. So I'm going to go back to the dashboard here. Note we also have this needs your attention section, which makes it super easy for the credentialing specialist to know exactly what to act on. So it keeps them very nicely responsive. We also have an activity feed at the packet level, which is filterable and again makes it super easy for them to respond and see exactly what needs their attention and what they need to act on. Excuse me. So one of the other things to note here is the credentialing specialist can download the complete packet. That's still super important for compliance reasons for them. They do need to be able to get a full copy of that on their local, although of course they do retain access as long as they have access to our system. They can also reshare the credentials with another member of their organization to make it easy, so they can either provide them with in-app access so they can reshare within the organization. They can create an email packet, which is password encrypted, and that is available to send via email. The nice thing about this activity feed is both the practitioner and the organization see it. So if they do reshare and hit that email packet, the practitioner will be able to see within the activity feed that the packet was in fact reshared. And on the seat management side, once an organization purchases a subscription to this, so first our subscriptions do start at $2,999 for the year, and that does include 3 paid seats. So you can see in this example here, we have 2 of these seats that are assigned. So you can see based on the colors, we can see these 2 are assigned. We have 1 available. We can add a practitioner to the 1 available. That could be either somebody that is new, in which case we'll send them an email invitation, or it could be somebody that has shared a packet from the practitioner side, because you can do a lot of this is actually available on our free tiers, but in order for them to have permanent access, that does require a paid account.
So I'm curious, how much is the paid account?
So the paid account for the annual membership for the organization side is $2,999 per year, which does include the 3 seats.
Awesome. So I know nobody likes to speak up in these rooms, but I'd love to hear any feedback, any questions from the audience. There's a couple coming in. Let's take a look.
Yeah, so I do see the system shortens the process. Yes, absolutely. It shortens the process because it takes a lot of the manual effort out of it because of these agents, especially when we get the employment history verification in place. That'll drastically shorten the process. The credentialing specialists will no longer have to do a constant back and forth with the former employees. That'll be all automated. And in this case, a seat is just means that when the organization purchases an annual subscription, they are allowed to include 3 practitioners within as part of their subscription. So they're effectively paying, or we call it sponsoring, 3 physicians to own their own wallets. So the physicians still own that data. So it's a win-win relationship on that side.
Yeah, and I know that we went through this really fast because I know you're busy and we want to really respect your time. But the physician side, you own your credentials, you can hold them, you can store them, you can keep them. You can keep the basic version, you can upgrade to pro. When you leave a system, you can take the credentials with you. The organization side is the thing that a hospital, a surgery center, a private practice, a telemedicine group would purchase in order to manage the credentials of the practitioners that work there. And when they sponsor your account, you don't have to pay. So essentially, they get it 2 for 1. They essentially get the credentialing suite and they also give you your wallet so that you can take those credentials and have them for life. And so that's really a unique play that we're doing. There's no other company that's doing this. And then there's also no other company that's offering agentic credentialing to independent physicians. So go ahead.
No, it's fine. And you'll note that for processes that will take a little bit longer to automate, I've populated this with a little bit of sample data here. So if we did have like an employment verification in process, we could go in and we could click on the credits and we could see all the items that are taking some time to process. So an employment history might take a few days. And it's a few days that you don't actually need to pay attention. So your credentialing specialists can work on other items. They don't have to keep monitoring this.
Yeah, and somebody's talking about the current experience that they're having in a hospital. They said something along the lines of, "Oh, the hospital's treating me like I'm from Mars and it's still 6 weeks later and they haven't even started the process." Yeah, I mean, people need to get with the program. The future is here. Our time is valuable. And I've heard over and over of physicians who start the credentialing process, 7 months later, they just leave and start another job. So there's a shortage of us, and hospitals are going to lose access to our talents if they don't start adopting systems that work. And so, yeah, somebody else said that they love the self-directed nature of it. I mean, this has been a frustration for me. I essentially am solving this problem for myself, but also with the input, the feedback, and the investment of 600 other doctors who also wanted to see this. So some of you are in the audience, and I'm really excited to see you, and I appreciate everybody coming. There's another question here. Can you provide access? Let's see. Oh, that one was deleted. Whoops. But I guess here's
Oh, it wasn't deleted. I responded to it. Sorry, sorry.
Oh, okay.
So,
Yeah.
so the question was, can you provide access for a limited period of time to organizations? And the answer is yes. Practitioners can set what we call a preview period, and that is the amount of time the organizations have to access their packet. So if an organization does decide to pay for that practitioner's wallet, then they do get permanent access. If you want to retain that control yourself, you can retain that control and set the amount of time that they'll have access to it. You have full control over that.
Oh, there's an interesting question about July essentially being the beginning of the year for hospital systems, because that's when residents start. So, yeah, we are going to keep that deadline in mind. We're definitely going to have the first bucket of licenses done by that date. As far as all 50, it's going to be a little tougher, but we're going to keep that deadline in mind so that we can get it done by that timeline. It would be really great if we do, but we don't want to make any promises. We'd like to make sure we get things on target. But I believe Oklahoma, New York, Florida, South Carolina, North Carolina are definitely going to be done by that date. Someone else is asking, so you're asking if you apply to a place that doesn't have my system and you have all your stuff in the wallet, you're screwed, right? No, that's actually not true, because everyone can have access to this for one practitioner. So if you send it to an email to somebody that's never seen this software before, they can open your packet for free. They can download your credentials. They can download the data around your credentials, and they get to use the software and they get to be invited to consider the possibility of using it instead of their current system, whatever that may be. So you can send this to anyone and they can test it out. And so will they actually use it for credentialing? That's up to them. But we are fairly confident that our system would be more robust and less expensive than what they currently have. Yeah. Amazing. So It's been such a pleasure to have everyone here. I appreciate you taking your time this afternoon to join us. And evercred.com, that's where you can find us online. We have a calculator on the website where you can calculate what kind of revenue you're going to save. We have a calculator to determine what you're going to pay for the software if you choose to purchase it. And we have a way that you can sign up to learn more if you're not ready to sign up for the application. But I'd love to hear everybody's feedback. This is built and designed based on everyone's feedback so far. And this is something that we as physicians need so that we can work and move freely and serve patients. So
Leah, we have one more question,
we
which
do.
is, yes, asking about an API to port credentials from another database. So we are working on integrations with existing systems like CAQH and some of those. Like you're also able to import your NPDB profile. So Kimine, do we have a backend API that we can directly link our credentialing system to another system? Let us know exactly what you'd love built, and we'd love to work on that for you. There are so many possibilities with regards to those kinds of APIs. We do those on an as needed per request basis.
Yeah, and the thing that we've been really careful about is architecting the database in a way that the data is structured so that if and when people do have those kinds of requests, implementation would be fairly easy and quick when you compare it to current implementations. So we're building for the future, and we're really excited that you're going to join us. So feel free to reach out to me anytime. My name is Leah Houston. I'm on all the social medias, and you can also reach out to me through the website. And thanks, Mark, for joining me today.
Thank
Bye.
you, everyone.
Yes, no more binders and spreadsheets. Exactly. I love that. Perfect ending. Take care, everyone.